Today we are going to talk about a very important topic, subarachnoid hemorrhage. I have uploaded many videos on subarachnoid hemorrhage. This patient, who is 45-year-old female, was presented with severe headache and vomiting, and we were suspecting subarachnoid hemorrhage because she were having a severe headache. So we did a CT brain, and on CT brain we see we diagnosed this patient with subarachnoid hemorrhage because there is hyperdensities. You see this hyperdensity, the hyperdensities in basal cisternae, the hyperdensities in Salvian fissure. So the next step, as we diagnose this patient with subarachnoid hemorrhage on CT brain, so the next step we do is CT angiogram, CTA, so that we can detect any aneurysm. Here we got the vertebral artery aneurysm. This is the aneurysm outfouching. Because of the rupture of this aneurysm, this patient got subarachnoid hemorrhage, and it's not very common that we get patient the subarachnoid hemorrhage having vertebral artery aneurysm. So यहाँ पे हमारे साथ फर्स्ट केस था vertebral artery aneurysm का. तो इस पेशेंट का vertebral artery aneurysm था, जिसकी वजह रप्चर हुआ था, जिसकी वजह से हमारे साथ subarachnoid hemorrhage हुआ था. ये आप लोग देख सकते हैं, ये हमारे साथ ब्लीड है, हाइपरडेंसिटीज़ है जो वाइट नज़र आ रहा है. ठीक है, यहाँ पे आप लोग देखें, यहाँ पे ये आप लोग के साथ ये नज़र आ रहे हैं. ठीक है, यहाँ पे भी आप लोग के साथ ये हाइपरडेंसिटीज़ ब्लीड वाइट नज़र आ रहे हैं. यहाँ पे भी आप लोगों के साथ ये सारा का सारा हमारे पास जो है ना ब्लीड है. ठीक है, हाइपरडेंस है, वाइट है. और दूसरा हमारे साथ जो, अगर आप लोग वेंट्रिकल को देखें ना, तो वेंट्रिकल काफ़ी डायलेट हुआ है, तो इसकी वजह से इसके साथ इस पेशेंट को हाइड्रोकेपिलस भी डेवलप्ड हुआ है. सो दिस पेशेंट हैविंग subarachnoid hemorrhage, extensive thick subarachnoid hemorrhage with hydrocephalus, and upon CT angiogram this patient is having the subarachnoid hemorrhage due to rupture of vertebral artery aneurysm. I have already uploaded many videos on subarachnoid hemorrhage and the treatment of subarachnoid hemorrhage. This subarachnoid hemorrhage was due to rupture of vertebral artery aneurysm. So the two score we have to find on when we having subarachnoid hemorrhage, the one is HNH, the another one is MFS. The HNH score for this patient was 4, which means 80% mortality, and MFS score for this patient was 4, which means 34 to 40% probability of symptomatic vasospasm. This vasospasm can cause infarct, so that's why we have to protect the patient from vasospasm, and for that we give nimodipine, which is 60 mg 4 hourly, and fletal, which is solistazole. This fletal solistazole 100 mg BD. So nimodipine and fletal 100 mg we give it for 21 days, because the from onset of the symptom till 21st days, this patient will having, in the 2 to 3 weeks, the patient having high chances of vasospasm. So that's why whenever you are giving to subarachnoid hemorrhage, whenever you are giving nimodipine or solistazole fletal 100 mg, you should give it for 21 days. For more detail on subarachnoid hemorrhage, I uploaded many videos. Kindly visit to and see it and watch it. Thank you.